Hello everyone and welcome to a new session, and in this session we are going to speak about beta blocker briefly and in summary. I am Dr. Khalid Hassan, Professor of Clinical Pharmacology, Clinical Research and Drug Therapy. As you can see here from this slide, we have beta blocker as a group of medication. We have the prototype, the main medication propranolol, followed by metoprolol. Then we have labetalol. Then we have carvedilol. Then we have carvedilol, timolol, then nebivolol. And in the previous session, we discussed the clinical use for each medication, and we are going to explain it briefly later on. Okay, moving to the alpha blockers, a brief mention about alpha blocker. We have a group of medication, start with the phenoxybenzamine, black alpha 1 and alpha 2 receptor. Then we have ventolamine, black alpha 1 and alpha 2 receptor, two medication. The main clinical use for this medication for the pheochromocytoma and for the Raynaud's disease. Then we have brazosine, which black alpha 1 receptor. Then we have dexosocin, black alpha 1 receptor. We have tamsuosin, black alpha 1A receptor. So from this slide here, we have different approach. If you can see it here, for phenoxybenzamine, black alpha 1 and phenoxybenzamine and phentolamine, black alpha 1 and black alpha 2 receptor. Brazosine, mainly black alpha 1 receptor. Dexazosine, black alpha 1 receptor. Tamsuosin, black alpha 1A receptor. And this one available in the bladder neck, and we use it for benign prostatic hyperplasia. Dexazosine and brazosine, we use it for hypertension and for benign prostatic hyperplasia. Phenoxybenzamine and ventolamine, we use it for the pheochromocytoma and use it for Raynaud's disease. And this is brief discussion about alpha. However, in our session, we are try to focus on beta blocker. So we have, as we mentioned here, we have propranolol, followed by metoprolol, labetalol, carvedilol, timolol, and nebivolol. Next, as you can see here, for alpha blocker, we have alpha and beta blockers. Then we have alpha adrenergic. Here we talk about medication with the generic and the brand name. So when you talk about blockers, here remember this another terminology, antagonist. So when you talk about alpha blocker, beta blocker, we talk about antagonist. Antagonist mean that this medication come to the receptor, occupy the receptor, okay, and prevent endogenous substance to bind to receptor. This medication block the receptor. Okay, so we have alpha receptor, less of medication. For alpha receptor, brazosine, minibres, we have terazosin, we have doxazocin, tamsuosin, alvazocin, phentolamine, and rigitine, phenoxybenzamine. Okay, what about our topic, beta blocker? Beta blocker, okay, we have beta adrenergic agonists, beta adrenergic antagonist. Here we talk about beta blocker antagonist. We have propranolol and brand name Inderal, atenolol, brand name Tenormin. Then we have metoprolol, two type, toberol XL for heart failure, and we have Librosor for hypertension, nadolol, Corcard, long-acting beta blocker. Then we have timolol for the glaucoma, bisoprolol, blood pressure, ismilol, cardiac arrhythmia, and then we have nebivolol, bistolic, and characteristic of nebivolol. Nebivolol, the only medication, the most popular medication in beta blocker that increase increase or stimulate nitric oxide in the blood vessels. Okay, moving to the next slide. About alpha and beta adrenergic, we have group of medication. As you can see, we have carvedilol and labetalol. Correct for carvedilol, Trandate for labetalol. We discussed that in previous slide or previous lecture. Then we have drug. Let me clean this one. Then we have okay. Then we have drug for the okay. Then we have a group of medication. Then we have a group of medication affect a neurotransmitter. I refer you here for the to the autonomic nervous system for more information about yohimbine and reserpine. So moving a little bit to understand what happened, adrenergic antagonist, we talk about the blocker here. So alpha blocker, we have beta blocker. So we have two group of medication for category. Okay, we have for alpha blocker, we have different category now. We start talking about non-selective alpha blocker. Non-selective alpha blocker, we have selective alpha 1, then we have selective alpha 2 blocker. So here we talk about medication block alpha 1, block alpha 2, or both. For blocking alpha 1, alpha 2, non-selective phenoxybenzamine and ventolamine. So as you can see here for the alpha blocker, okay, so for the alpha blocker, non-selective, block alpha 1 and alpha 2. As you can see here, we have ventolamine and phenoxybenzamine, and this medication used for pheochromocytoma and Raynaud's disease. Alpha 1 receptor blocker, we have dexazocin, we have brazocin, we have alvazocin, then we have tamsulosin, and most of these medications used for benign prostatic hypertrophy, and the first group is like we use for hypertension and prostatic hypertrophy, hyperplasia. Alpha 2 receptor, we have yohimbine. Okay, now we move to the beta blocker or beta adrenergic antagonist. We have first generation. Number one, non-selective. First generation means block beta 1 and beta 2. Here we talk about beta 1 and beta 2. Okay, non-selective, speak about beta 1 and beta 2. Propranolol, timolol, sotalol, nadolol, and benzolol. So the question here, which receptor will be affected by propranolol? So propranolol blocks beta 1 and beta 2 receptor. Timolol block beta 1 and beta 2 receptor. Nadolol blocking beta 1 and beta 2 receptor. Okay, then we have beta 1 selective. Beta 1 selective only, first generation. Beta 1 selective generation. We have acebutolol, atenolol, bisoprolol, esmolol, metoprolol. Beta 1 selective, second generation. Then they developed third generation beta blocker. For third generation beta blocker, we have non-selective and selective. We have carvedilol, labetalol, bisoprolol, and cartulol for as non-selective third generation. Speaking about beta 1 selective third generation, we have nebivolol and betaxolol. So third generation. Nebivolol, betaxolol. Clinical use of beta blocker. What is the clinical uses of beta blocker? We use it for hypertension, for example. We use it for patients from angina pectoris or angina pectoris. We use it for myocardial infarction. Okay, again, I refer you to this topic. We have it in the YouTube channel, hypertension, angina, myocardial infarction, for more details. Cardiac arrhythmia, sotalol, esmolol, two medication for that. Heart failure, yes, carvedilol, metoprolol, one of the most important medication. Glaucoma, we have timolol, betaxolol, cartulol. We use it for hyperthyroidism because when in patients with hyperthyroidism we have activation of sympathetic system. Our medication beta blocker inhibits sympathetic system and control heart rate, tachycardia, control tremors and sweating. We use it for some neurologic diseases such as migraine, tremors, anxiety, and PTSD. Okay, so this list of maybe clinical use of beta blocker. Is there any side effect or unwanted effect related to the beta blocker? Yes. So adverse effect, contraindication, precautions of beta blocker, beta agonists such as propranolol. Okay, as you can see here, the propranolol may cause peripheral vasoconstriction, and this explains that by decreasing cardiac output, and this will lead to the blockade of beta 2 receptor, and the patient may suffer from complaint of cold extremities, called hands and feet, and this will worsen the symptoms of Raynaud's phenomenon or Raynaud's disease, and patient may develop Raynaud's disease also, which is related to the vasoconstriction in the peripheral arteries. Okay, so the first side effect, important one, peripheral vasoconstriction. Then they found the mechanism is not clear. Beta blocker in general and propranolol in specific may cause sexual impairment, and the reason, as I mentioned, is not clear. Beta, when you prescribe beta 2 receptor or beta blocker to the patient, this will lead to the blunt or mask symptom of hypoglycemia, uh, such as tremor, tachycardia, and nervousness. If you need more detail about that, I recommend you to go back and review the YouTube about diabetes. We have it on our channel about type 1, type 2 diabetes and clinical pharmacology of diabetes. And with that, we have more explanation about why you don't recommend to use a beta blocker in patient with diabetes, because the main reason here, like masking symptom of hypoglycemia. Thank you so much for your watching, and see you next time. Have a great day.